Welcome to our channel. Arthritis, which affects millions worldwide, is a condition characterized by inflammation and stiffness in the joints, and can significantly impact daily life. Managing arthritis can seem like an unending struggle on both a physical and emotional level. While medical treatments play a crucial role, the foods we eat can also influence arthritis symptoms. In this guide, we'll explore arthritis's relationship with food, focusing on the top 8 foods that could be either its best friend or worst enemy. Join us on a journey through nutrition and arthritis management, as we uncover the foods that can either soothe or exacerbate joint pain. So, let's get started. Sugary sweets and sodas. When you indulge in the consumption of sugary foods and beverages, your body responds by increasing the production of inflammatory markers. These markers, known as cytokines, are signaling molecules that promote inflammation throughout your body, including in your joints, and contribute to the progression of arthritis. Now, the more inflamed your joints are, the more pain and discomfort you're likely to experience. High sugar intake can disrupt the balance of beneficial bacteria in the gut, leading to dysbiosis. Dysbiosis is associated with increased intestinal permeability and leakage of bacterial byproducts into the bloodstream. This can trigger an inflammatory response and exacerbate arthritis symptoms. So every time you reach for that sweet indulgence, consider the long-term impact it makes on your joints. Opt for natural sugars in fruits like honey, but in moderation. This can satisfy that sweet tooth without inflammation. Processed and red meat. These proteins are common diet staples, however there is a risk for those who have arthritis. Processed meats often undergo cooking methods that result in the formation of advanced glycation end products, AGEs. These compounds can promote inflammation, adding to the discomfort and pain associated with arthritis. Both processed and red meats tend to be high in omega-6 fatty acids, particularly when the animals are fed grains instead of grass. Omega-6 fatty acids, when consumed in excess and not balanced with omega-3 fatty acids, can promote inflammation in the body, contributing to arthritis flare-ups. But don't worry, this doesn't mean you have to stop enjoying meals with savory flavors and satisfaction. There are lots of delicious, joint-friendly, and inflammation-fighting substitutes available. Consider plant-based proteins derived from lentils and legumes, or fatty seafood like salmon that are high in omega-3 fatty acids. These can be excellent replacements that improve joint health and provide your diet some diversity. Now let's move on to a subject that has received a lot of attention lately: gluten. Gluten, a protein found in wheat, barley and rye, can potentially increase inflammation, and can be a source of discomfort for those with arthritis. It's important to note that not everyone with arthritis will experience increased inflammation. Only in individuals with celiac disease or non-celiac gluten sensitivity, consumption of gluten can trigger an immune response. This response involves the release of inflammatory cytokines and antibodies, leading to inflammation in the gut and potentially affecting the joints. However, for individuals who suspect gluten may be contributing to their arthritis symptoms, steering clear of gluten can be a game changer in managing pain and inflammation. The good thing is, as a result of increased awareness of gluten sensitivity, there are lots of gluten-free substitutes available on the market. Your options aren't limited, from rice and quinoa to bread and pasta made without gluten. Trying out these substitutes will not only help lessen the symptoms of arthritis, but also introduce you to a whole new range of flavors and cuisines. Next on our list is fried and processed food. Well, these foods are hard to resist as they are delicious in taste, but unfortunately, they are inflammatory. According to researchers from the Mount Sinai School of Medicine, cutting out fried foods can reduce your levels of inflammation. The study found that when foods are cooked at high temperatures like frying, they contain toxins called advanced glycation end products, AGEs, which can lead to inflammation and exacerbating arthritis symptoms. Fried and processed foods often contain high levels of trans fats, which are formed during the process of hydrogenation used to make oil solid at room temperature. Trans fats promote inflammation in the body and can lead to more severe joint pain and stiffness. However, adopting healthy cooking methods such as baking, steaming, and sauté can help minimize the formation of harmful compounds and promote joint health. Choosing whole, unprocessed meals allows your body to get the nutrients it needs to naturally combat inflammation, while also reducing your exposure to aging. Next, let's talk about alcohol. Alcohol is a great way to celebrate for many, but if you have arthritis, you should give it another look. Some alcoholic beverages, such as beer and certain types of wine, contain purines that can be metabolized into uric acid, which can further lead to the formation of urate crystals in the joints, triggering inflammation and contributing to conditions like gout, which is a form of arthritis. Excessive alcohol consumption can disrupt the integrity of the gut barrier, leading to increased intestinal permeability or leaky gut. This allows harmful substances to leak from the intestines into the bloodstream, triggering an immune response and inflammation throughout the body, including the joints. Alcohol may interfere with medications commonly used to treat arthritis, making your management plan less effective. Alcohol consumption can contribute to weight gain, which can put extra pressure on your joints, further aggravating arthritis symptoms. There are lots of delectable non-alcoholic drinks available that won't damage your joints, ranging from invigorating mocktails to calming herbal teas. These substitutes can help you stay hydrated, lessen inflammation, and take pleasure in social events. Salt. Although salt is a necessary ingredient, consuming too much of it can cause a number of issues, especially in case of arthritis. Salt may interfere with the function of regulatory immune cells called TREGs, regulatory T cells. TREGs play a crucial role in controlling inflammation and maintaining immune tolerance. But excessive salt intake can lead to disruption of TREG function, thereby causing inflammation, potentially exacerbating arthritis symptoms. Excessive salt intake can also increase the amount of calcium lost in urine, which is essential for bone health. High salt intake can lead to dehydration, which can exacerbate joint pain and stiffness in arthritis patients. Excessive salt intake has been linked to the promotion of autoimmune responses, in which the immune system mistakenly attacks the body's own tissues, leading to inflammation and joint damage. To help reduce these risks, individuals with arthritis should moderate their salt intake. Choose fresh whole meals over processed ones and embrace the natural flavors of food with herbs and spices. You can also make better decisions by reading labels and avoiding hidden salt in packaged meals. Now let's talk about a more controversial topic: nightshade vegetables. Nightshade vegetables belong to the Solanaceae family and include tomatoes, potatoes, peppers, bell peppers, chili peppers, and eggplants. They include a substance called solanine, which some people think can make arthritic symptoms worse. Solanine may cause problems for the enzymes in the muscles, which could cause pain and inflammation in people who have arthritis. It's crucial to remember that there is conflicting scientific data on this subject, and that each individual's experience may differ significantly. If you think nightshades may be harming your arthritis, try removing them from your diet for a few weeks, and note if your symptoms change at all. This way, you can find out whether you can safely include these vegetables in your diet or not. You can opt for plenty of nutritious and delicious alternatives, like leafy greens, sweet potatoes and squash, without potentially aggravating your arthritis. Last on our list, but certainly not least, a dairy product. Dairy products are an important part of people's daily diets, but they can be a double-edged sword for people with arthritis, particularly those who have an underlying sensitivity to dairy. Casein, a protein found in milk and dairy products, may lead to immune system reactions and inflammation. Beta-lactoglobulin is another protein found in dairy products that some individuals may be sensitive to. Consumption of dairy products containing beta-lactoglobulin may trigger an immune response and inflammation in susceptible individuals, potentially worsening arthritis symptoms. It's important to note that not everyone with arthritis will experience inflammation from consuming dairy products. There are various types of plant-based milk available, including almond milk, soy milk, coconut milk, oat milk, and rice milk. Some individuals may prefer fermented dairy products like yogurt or kefir, which are better tolerated than others. You may continue to eat a healthy, calcium-rich diet with these alternatives, all without the possible inflammatory effects of conventional dairy. In conclusion, understanding the impact of food choices on arthritis symptoms can empower individuals to make informed dietary decisions that support joint health and overall well-being. By prioritizing nutrient-rich, anti-inflammatory foods, individuals with arthritis can nourish their bodies and promote optimal joint function. If you find this information useful, please hit the like button and subscribe to our channel for more informative content.